Okay, so we know from our own research on the real cost of cancer that cancer patients can face medical costs of an average of €750 per month, while their income may fall by an average of $1,800 per month. So there are significant financial challenges that go along with a cancer diagnosis. There are social welfare payments to help people who have received a cancer diagnosis. However, you will not receive them automatically. So it's very important that you're informed about what supports are available and how you can access them. Remember, if we don't get to cover everything today, you can always contact our nurse line at 1-800-200-700. Our nurses are very well informed on all of these issues, or you can email me at advocacy@irishcancer.ie. So let's get started. Today we're going to talk about medical cards and GP visit cards, illness benefit, invalidity pension, partial capacity benefit, long-term illness scheme, the supplementary welfare allowance, the drug payment scheme, and the cross-border healthcare directive, and also travel insurance and the European health insurance card. So first off, medical cards. So a medical card would entitle you to free GP services, free prescriptions. There may be a charge of €2 per item, up to a limit of €20 per month per family. Free medical aids and appliances, and this includes wigs and hairpieces up to a certain value. Free inpatient services in a public ward in a public hospital. Free outpatient services, free accident and emergency care, and community care services such as public health nursing, home health, respite care, etc. There are also other entitlements such as dental, optical care, and counselling services. So how do I qualify? Firstly, you must pass a means test. This means that your weekly income must be below a certain figure for your family size. Cash income, investments, savings, and property apart from your own home are taken into account in the means test. There are different rules for the means test for people over 70 and under 70. There are quite a lot of factors that go into calculating the weekly income to qualify for a medical card under the means test. These include how many children you have and their ages. But if we take an example, a young couple with 2 young children, the weekly income limit to qualify after tax for a medical card is €342.50. Citizens Information has an excellent section on medical cards which gives lots more details about qualifying under the means test. There are also expenses which are allowable, and these include childcare, rent, mortgage costs, etc. There are certain categories of people who qualify for a medical card without passing a means test. These include children under 18 who have been diagnosed with cancer within the last 5 years. So how do I apply? The fastest way to apply for a medical card is online at www.medicalcard.ie. You can also download the form at the HSE website and return it by post. They have a low call number at 1890-252-919. You can also get the application form from your local health centre. And you can track your application at medicalcard.ie. So that is a very useful website to visit. So if your income is above the means test limit, you may qualify for a medical card if your circumstances would result in hardship without one. So many cancer patients who do not qualify under the means test may be able to get a discretionary medical card if they have extra medical and other expenses related to their treatment. In order to prove your need, you will need to include information about your medical expenses, including hospital bills, receipts for doctor's visits, and prescriptions. And you'll also need to include a medical report in your application. If you do not qualify for a medical card, you will be automatically assessed by the HSE for a GP visit card. And these entitle you to free GP visits. Children under 6 and adults over 70 are entitled to a GP visit card. And if you're a carer and receive carer's benefit or carer's allowance, you will get a GP visit card. Again, there is a means test to qualify, but the income levels are higher than for the medical card, and they take into account the same factors. So if we use the same example of a young couple with 2 young children, the income level for a GP visit card is €557 per week. Again, the HSE will factor in expenses such as rent, childcare, and mortgages into their calculations. So you need to include details of all of these in your application. You can apply for a GP visit card at www.medicalcard.ie, or you can get the application form at your local health office. So we're going to move on now to illness benefit. You may get illness benefit from the Department of Social Protection if you cannot work because of your cancer diagnosis. It is a payment for PAYE workers, and it's paid for a maximum of 2 years. You must also be medically certified as unfit for work. You must be aged under 66 and covered by PRSI. This means you must have paid a certain amount of PRSI since you first started work. And more information on the PRSI requirements is available at citizensinformation.ie. If we look at the rates of payment, you will see that it depends on how much you were earning before you got sick. So if you look at the table, if you're earning €300 a month or more per week, you will receive a personal rate of illness benefit of €203. And if you have an adult dependent, such as a spouse, you will get an additional €147. So how do we apply? You must apply within 6 weeks of becoming ill. You must be medically unfit for work, so you must get a certificate from your doctor to say that you cannot attend work. You must claim illness benefit from the first day of your illness, even though you will not be paid illness benefit for the first 6 days. These are called waiting days. If you are getting sick pay from your employer, you may need to nominate your employer to receive the illness benefit. You should ask your employer what the arrangements are if you receive sick pay from work. So you should complete the IB1 form, which is available from your GP, or you can apply online at www.mywelfare.ie. Your GP will complete the certificate of incapacity for work either online, or they will give you a paper copy to submit with your application. And then if you're going with a hard copy, you submit it by free post to the Department of Social Protection. So we have a case study here of a cancer patient who is receiving illness benefit. So Rob is 33, he's a gym instructor, and he's been diagnosed with non-Hodgkin's lymphoma. He'll need to take some time off work to attend treatment. Now, even though he's been working for several years for the same company, they do not offer any paid sick leave. However, he has been working long enough and has paid enough PRSI to apply for illness benefit for the duration of his illness. So he will need to complete the illness benefit IB1 application form and request a certificate of incapacity for work from his doctor to access that payment. So the next payment that we're going to talk about is the invalidity pension. This is a weekly payment for people who cannot work long-term due to illness. So to qualify for this payment, you must have been incapable of work for at least 12 months and likely to be incapable of work for at least another 12 months. So about 2 years off of work. You may have been receiving illness benefit or disability allowance in the previous 12 months. Or you must be permanently incapable of work due to illness or disability. Similar to the illness benefit, you must be under 66 and have paid enough PRSI contributions since you started work. For the invalidity pension, to qualify for that, you must have paid 5 years of PRSI contributions to qualify. And you also need to have paid 48 weeks of PRSI in the year or two before your permanent incapacity. So how to apply for invalidity pension? So you need to complete the application form INV1, which is available from www.welfare.ie or at your local social welfare office. You may claim for supplementary welfare allowance while you're waiting for your claim to be processed, and I will cover that allowance later in the presentation. So if you've been getting illness benefit for 468 days, which is about 15 months, you'll be automatically assessed by the department for your continued entitlement to illness benefit, and they may transfer you to an invalidity pension. If you receive the invalidity pension, you will also be entitled to a free travel pass. And the rate of payment for the invalidity pension is a maximum weekly rate of €208.50. And there are increases for any adult or child dependents that you might have, which are set out on the table there. And I'll leave that up for a couple of seconds. Now, the next benefit we'll talk about is the partial capacity benefit. So this payment allows you to return to work or self-employment. However, due to illness, due to illness or disability, you may be wishing to return to work only part-time, and you may need to receive some form of social welfare. So you may qualify for partial capacity benefit if you've been receiving illness benefit for at least 6 months, or if you are on an invalidity pension. This is a voluntary scheme, and you may return to your previous payment, be it illness benefit or invalidity pension, if something happens with your job, if your employment ceases, or you find that in fact you are not able to continue to work. So in order to apply for this, you should apply before you go back to work. You may not work until you get written approval to do so from the Department of Social Protection. So you should contact the partial capacity benefits section of the Department of Social Protection to request the application form. The department has a very good benefit of work estimator tool on its website, mywelfare.ie, which allows you to assess the financial consequences of going back to work and claiming partial capacity benefit. So you can compare your current benefits against how you would be financially if you went back to work and were receiving the partial capacity benefit. The forms, unfortunately, for this benefit are not currently available online, so you do need to contact the relevant section of the Department of Social Protection to get the application form. So a medical assessor will assess the restriction on your capacity for work, and you may need to attend a medical assessment. You should include all appropriate medical evidence with your application. In terms of the rate of payment, this will be based on the medical assessment that will be performed by the department. So they will assess your capacity for work. And if they say that your medical assessment is moderate, you will receive 50% of your illness benefit or your invalidity pension. If it is severe, you will get 75%. And if it's profound, you will get 100% of the payment. So if we look at our case study here, Joe is 36. He's a cancer patient who has been receiving illness benefit for 8 months while he was on treatment. He has agreed with his employer that he would like to return to work in a reduced capacity until he is well enough to go back full-time. So Joe will need to apply and be approved for partial capacity benefit before returning to work. And part of that application process will involve being medically assessed for his restriction on his ability to work. So the long-term illness scheme, this is a payment which covers drugs and medicines for a certain list of medical conditions. It only applies to these certain conditions. There is no means test for this. And the only type of cancer that is covered under this scheme is acute leukemia. The form is available on the HSE website and you can download it there. So, supplementary welfare allowance. I did refer to this earlier in the presentation, as this can be kind of a stopgap benefit that can be applied for if you're waiting for a decision from the department on an invalidity pension or another form of welfare. So this is a weekly allowance, which is paid to people who don't have enough income to meet their needs. It is a means tested payment, and you can qualify for it if you have no income, or if your weekly income is below the supplementary welfare allowance rate for your family size. You can also qualify if you've claimed a social welfare benefit or pension and has not yet been paid, and you have no other income in the meantime. You also must be registered for work with your local intro centre. So you should apply for the supplementary welfare allowance through the community welfare service at your local social welfare office, and you should apply as soon as the need arises. You will need to complete form SWA1, and that's available at your social welfare centre and also online. And you will include PPS numbers for your family, proof of address and identity, as well as documents proving your financial situation. So as you can see from our table here, the maximum rate for an adult over 25 is €201 per month, and this will increase if you have adult or child dependents. So if you have one adult dependent, you will get an additional €134.70, and then you will get €36 per child under 12 and €40 for a child over 12. And that's a per week rate. Now, moving on to the drugs payment scheme. This scheme helps with the cost of prescribed medicines and means that no household in Ireland will pay more than €124 in each calendar month for approved prescribed drugs, medicines, or rental costs for CPAP machines and oxygen. If you don't have a medical card and you are currently paying more than €124 a month for prescription drugs, you should apply for this scheme. This is not a means-tested scheme. A household can be a single person, a married couple or cohabiting couple, or a family with children. You can add children in full-time education up to the age of 23 on your card. It can take up to 4 weeks to process the application, so it's important to keep all of your pharmacy receipts so that you can claim back any costs over €125 from the HSE. You can apply online at www.mydps.ie or apply at your local health office or pharmacy. The Cross-Border Healthcare Directive allows you to apply for medical treatment in any EU country, Iceland, Liechtenstein, Switzerland, and Norway. You must qualify for public healthcare in Ireland. You can access this healthcare abroad in the same way as you would get public healthcare in Ireland. So this healthcare must be planned. You will need a valid referral from a public health professional, such as your GP or your hospital consultant. And we recommend that you see your GP first and discuss your condition and then decide if you need a referral from a consultant or if you can get one from your GP. You can use your referral letter or waiting list letter to access healthcare abroad. You must arrange an outpatient appointment with a healthcare provider abroad. This consultation will help you to decide if you're comfortable with the consultant and the hospital and if you want to proceed with the healthcare abroad in the future. You cannot do this initial appointment using telemedicine or video call. It must be in person. Once you go abroad, you must pay for any healthcare that you get. You can then apply to the HSE for reimbursement towards the cost of that healthcare. You can also apply for prior authorization from the HSE before you travel, and you may wish to consider this so that you'll be more confident that you will be reimbursed on your return. You cannot claim for any medicine you will need after treatment or for your travel costs. This is a different scheme from the Treatment Abroad scheme, which applies to treatments that are not available in Ireland. The Cross-Border Healthcare Initiative applies if the treatment is publicly available in Ireland, and it's frequently used when people are on waiting lists for this treatment. There is healthcare that is not available under the Cross-Border Directive, and these include organ transplants, clinical trials, and drug therapies that are not available publicly in Ireland. So 3 things to remember about this directive. First, do your research and make sure you're eligible for this scheme. Number 2, consider applying to the HSE for prior authorization before you travel. This is optional, but it will put your mind at ease if you know you're covered and will have an indication of how much you can claim back. You can do this after you've had your initial consultation with your consultant overseas. And number 3, make sure you have travel insurance and bring your medical records. The HSE has a really excellent section on its website about this scheme, and it is well worth a look if this is something that you are considering. So we briefly mentioned travel insurance in the last section, and even though not many of us are traveling at the moment, it is important that when we're able to fly again, we should consider travel insurance. It can be challenging to access travel insurance as a cancer patient or survivor. However, there are a few things that you could do to make things a little bit easier. Firstly, discuss your travel plans with your doctor and ask them for a letter stating that you are fit to travel. Start looking for travel insurance before you book your holiday and check the cost. Be sure to shop around and check the policy carefully to ensure that you're fully covered. Be honest about your medical condition and treatment, otherwise you may not be fully covered. Lastly, make sure you have a European health insurance card for everyone in your family if you are visiting Europe. So the European Health Insurance Card. This entitles you to public healthcare in the EU, Iceland, Liechtenstein, Norway, and Switzerland if you become ill or injured while visiting any of these countries. You should apply before you travel. You can apply online via the EHIC portal on the HSE website if you have a medical card. Otherwise, you can download the form and send it to your local health office. It takes about 4 weeks to process, so be sure to do this before you travel. The cards are valid for 4 years and do not automatically renew, so be sure to check your validity and renew your card. And each family member must have their own card to qualify for treatment. So finally, I'm leaving up some contact details for the many resources that are available to learn more about benefits and entitlements. Citizens Information is a really fantastic website for all of these government supports, and it provides up-to-date information on all aspects of living in Ireland, as well as links to online application forms. So this should be your first port of call. Citizens Information also has 215 public information centres all across the country, and they've really well qualified staff who can help you in person or over the phone. The Department of Social Protection allows online application for certain welfare benefits at mywelfare.ie, so that's also a good stop. And lastly, our own website, cancer.ie, offers information on certain benefits, and we also have a very comprehensive booklet on managing the financial impact of cancer, which covers everything that I spoke about today and lots more. This can be emailed to you or sent by post. And you can get this through the nurse line at 1-800-200-700 or email me at advocacy@irishcancer.ie and I will pass it on to have the booklet sent to you. Or as I said earlier, if you have any specific questions relating to your own personal situation with regard to any of the topics that I spoke about today, please do feel free to drop me a line at advocacy@irishcancer.ie and I will do my best to help you. So I'm going to go back to our chat and we will see if we have some questions from Lucy.
Hiya.
Hi, Lucy.
So the first question is, if someone has occupational sick pay, but this is time limited, can they then apply for illness benefit or invalidity pension when their work sick pay runs out?
Oh, so there's sick pay from work. Yeah. So I would say you should speak to your employer because they you do need to apply for illness benefit within 6 weeks of being unable to work, and you do need to apply from the first day of your illness. So from the first day that you are unable to go to work, you need to apply from that date. But speak to your employer because they may want your your illness benefit to be directed to them, and they will supplement it if they're paying you your salary for I think you said 6 weeks or for a certain amount of time. And then once your occupational sick pay runs out, you would likely go on to then the state illness benefit rate.
Perfect. So for those still on the pandemic unemployment payment during treatment in place of illness benefit, does that rule out partial capacity benefit on return to work?
Oh, that is a very interesting one. So the pandemic unemployment payment during treatment. So you're on pandemic unemployment benefit payment. Elaine, I would have to do a little bit of research on that one for you. I'll take your name, and maybe you might just pop that into an email, and at advocacy@irishcancer.ie. I'll just type it into the chat now. That would be great, because I'm not sure that pandemic unemployment is very new, obviously, just this year. So I would need to do a little bit of research on that.
Perfect. There's one other question here, but you might not be able to answer this. I was diagnosed with cancer in September 2019. I did not require chemo or radiotherapy. A hysterectomy was sufficient. I have glaucoma and require medication. Am I entitled to medical card on medical grounds? But I assume that would be means tested.
Yeah, so medical cards are means tested, or as I said, cancer patients can sometimes access medical cards if their income is above the income level by demonstrating severe hardship due to their medical costs. So if you have very high medical costs ongoing, or if you cannot work because of your cancer or your treatment, then you could apply for a discretionary medical card. And you apply for that in the same way as you apply for a regular medical card, but we would recommend that you submit as much information as you can to make your case for the financial hardship that you're going through. So that would include receipts from doctor's appointments, receipts for prescription medication, and any loss of income that you're suffering, as well as the expenses that you have while you're going through your treatment, your regular day-to-day expenses, so whatever your rent and your childcare or your mortgage payments are. All of that information will help you to make your case for severe financial hardship for a discretionary medical card.
Perfect. Magella has come back and said, I understand that illness benefit is limited to 2 years, but if someone has a recurrence after returning to work, can they apply afresh for illness benefit?
Magella, I think there probably is a period of time that you have to be back at work before you can access illness benefit again. There tends to be. I don't have it off the top of my head. So if you would pop me an email, I will find that out in the meantime, and I will get back to you on that. But usually there is a period of time that you have to be back at work before you can access a benefit again.
Perfect. There's nothing else coming up unless anyone has any other questions.
Looks like somebody was starting a question there, but I don't see the rest of it coming. Okay, well, unless there's any other questions, we can leave it at that. I'm just going to pop my email again into the chat one more time. So please do feel free to, oh, Sheila, okay, thanks. So Sheila is saying she thinks it's 3 months, Magella, that you need to be back at work before you can access illness benefit again. But I'll double check that just to confirm. So that we can, yeah, thanks very much, Sheila. Really appreciate that.
Yeah, I think that's all the questions we have at the moment.
Okay, well, my email is there in the chat, and also Advocacy has a booth in the expo. So if you click on the expo button on the left-hand side of your screen and you go into the Irish Cancer Society Advocacy virtual booth. I'm monitoring the chat there as well. So if you have any questions or anything occurs to you this evening or tomorrow, pop in there and you can ask the questions there and I can get back to you from there. So thanks very much to everybody for coming along. I hope you found it informative, and please do drop us a line if you have any other questions. And thanks, Lucy, for moderating.
No problem.